Ikore ne bago romo magalamoro chakre wuok tich juma manyien. Mano mar somo paro ewi yore mag tieko thoe mag mine kod nyithindo matindo e kinde nyuol. Koloso gi jofwambo, apisa motelo ne weche mag nyode migawo mar thieth lero ni kata obedo ni Kenya oseteme thiro thoe mabiro seche mag nyuol, kwan mine gi nyithindo mawito ngimagi pacho ka pod ni malo ahinya. Sifus Okinda nigi ler.
Kaluwore kod lipot mar kwan oganda manotime pacho ka higa mar 2019, mine kod nyiri maromo 5,000 wito ngimagi higa ka higa kaluwore kod midhiero mabiro e kinde mag pek kata kinde mag nyuol. Kamano bende nyithindo ma korka onyuol maromo 30,000 wito ngimagi higa ka higa. Kaka achiel kuom okenge mag tieko thoego kendo chopo kare lek mar higa 2030, piny Kenya dhi bago romo magalamoro motisi ni International Maternal Newborn Health Conference chakre wuok tich juma manyien.
We would like to learn more on how other countries have effected their integration. I think that is still one of the issues, and that's the reason why I'm talking about. We are going to the conference to learn, share knowledge, get the best practices and the strategies which are working.
Romo no madhi kelo kanyakla jolony mag science e weche mag nyodo mawuok e pinje 100 mopogore biro konyo pinje nonore e okenge mag gisegoyo e wi duoko piny midhiero mabiro e kinde nyodo kod okenge monego go e tieko chutho thoe makamago.
From 1993, we have been the maternal newborn deaths have been coming down until somewhere like 2016 we have mentioned, and it has stagnated for now the last 10 years. So the reason is, having known that data, then this is now why we are doing the awareness and RRI, because we have realized that we are not making progress.
Migawo mar thieth lero ni gisetemo goyo okenge mathoth e duoko chien thoe makamago, kamoting'o chako keto nonro jotuo kod medo masinde ute thieth ma pacho ka.
As you are all aware that the DHA, the digitalization has now happened in about 28 counties, and that is part of getting real-time data, because it's availability of data which will advise and provide policy direction on what interventions needs to be done.
There has been an increase of incubators in our newborn units from different funding that we have as national government. It is something that we are working towards. We are not yet there in terms of, you'll find some high burden facilities, we are still grappling with that challenge. But currently I can confidently say it has been work in progress, and we are having facilities, having more commodities and even incubators, and babies not sharing as much as before.
Kamano, migawo no lero ni nitiere weche matama kamoting'o minere mchope od thieth e samo winjore kod kwan mapiny ma jochiw thieth ma pod mono lakteche chiwo thieth e yo makare.
When it comes to quality of care and our healthcare workers, our numbers are still low. In terms of, then, for example, if it's a nurse, a pediatrician meant to attend to the newborns, the numbers are still low. And also, in terms of their expertise, we've been training many of the counties and healthcare workers when it comes to comprehensive newborn care. This training that we have been doing has shown success and has shown that once you equip them with the quality care that they need to provide, the numbers will go down.
So the first delay in this model is called the delay within the community, a delay to make that decision to go to the hospital. The second delay is what happens from the point of making the decision to go to hospital and arriving.
Romo no biro bagi boma Nairobi chakre tarik 23 nyaka 26 mar dwe ni. Sifus Okinda, Ramogi TV.